Details in the report from Lusaka by Arthur Davis Scopo.
COVID-19 jabs are proving to be gaining momentum in Zambia, and skepticism among many is now reducing when government opened up a number of sites around Lusaka and some parts of the country where citizens could get vaccines. First shots for those who did not get, and second shots for those that got the first round. Many flocked to the sites as early as 06 hours in the morning. The queues were too long, and some stood for over 4 hours just to have access to the pandemic fighter. This journalist has established that there are more than two things involved. Some say they now have adequate knowledge on the vaccines, while others are doing it because they felt the pain and anguish the disease presented on them when they got infected.
I just got jabbed. There's nothing strange about it. Better we protect ourselves and the people around us. I think the benefits outweigh the negatives, so it's better that we can gauge for ourselves.
Sharon Kalimbula of Lusaka tells us her experience.
So I decided to take the COVID-19 jab after the experience I went through when I tested positive for COVID-19. For the first consignment, I was really against it because we didn't really have information personally, on a personal level really. So I thought I'm not going to take the jab, but after the experience I went through, it was a trigger, and I got the first jab, and I'm hoping to get the second one as well. I'm confident it will work better and help me reduce the risks of contracting the virus once again, or if at all I do, the effects will be lessened than the first time I tested positive for it.
Dr. Francis Mopeta, an infectious disease specialist, consulting with the World Health Organization, weighs in on the increasing numbers of people wishing to access the vaccines.
You are actually likely going to develop a clot from COVID itself than the vaccine. So you should weigh, what would you be afraid of? COVID, and then which can give you the likelihood of developing a clot, or the vaccine which prevents you from having COVID and then which does not necessarily give you a clot. And we know the Western media has outblown this. It's always important that we observe our data here in Zambia and also as Africa as a region. So since in Zambia, since we started vaccinating, we haven't reported a single case of clotting. And equally, in many African countries that have given AstraZeneca, which is the most common vaccine on African soil. So for me, I would actually tell people that these fears are more in a certain population that is of Western origin.
Meanwhile, Zambia is seeing some reduction in cases in the last few days. Ministry of Health Permanent Secretary Kennedy Malama says it is encouraging to see drops in between peaks in terms of cases, admissions, and severe diseases, but cautions that this improvement should not be a cause for celebration as the pandemic is still there.
So we've distributed the vaccines countrywide, and if you see in the report, all provinces now have started vaccinating. We already note that Lusaka is a big driver of the vaccination program, and the appetite for the vaccine is very high. And don't be surprised if you hear us saying we've moved vaccines from province A to province B, because they are not moving as expected. Yeah. Because for Lusaka already we've seen, like in the last 24 hours, Lusaka did almost 12,000 alone. So Lusaka is doing far much better. We see Luapula also to be quite aggressive. One thing we will not allow as a country are the vaccines to go to waste.
The country was recording high positive figures in 24 hours, close to 4,000, but now the average is 900 in the same 24-hour period. Zambia's cumulative vaccinations to date stand at 150,000 for those that have gotten the AstraZeneca jab, while Sinopharm has over 41,000 people so far jabbed. A total of 2,830 have so far died in the 17 million populated nation, while 175,000 have contracted the virus, which currently 12,700 have the virus. Reporting for Channel Africa in Lusaka, Zambia, I am Arthur Davis Scopo.
Madagascar is one of the highest chronic malnutrition rates in the world.